Hello, everyone. In this podcast, we will be discussing sensitive topics such as sexual assault. It's important to take care of yourself while listening. Some suggestions are listening while you're in a healthy headspace or knowing who you can reach out to if you become upset. Our 24/7 helpline for crisis calls based out of Central Florida is 407-500-HEAL. By contacting the national hotline at 1-800-656-4673, you can get support and learn about your local resources. There's always someone ready to help.
Welcome to the Victim Service Center podcast. Here we sit down with professionals that serve survivors and victims of trauma or those who've experienced violence and have conversations about social issues. This week, we are talking about caregiver identity and burnout. My name is Emilie Mitchell. My pronouns are she, her, and I am the education coordinator at the Victim Service Center of Central Florida. With me today, I have Jacqueline Padilla. Jackie uses she, her pronouns and is the trauma-informed pilot project coordinator at Help Now of Osceola, where she has worked for the past 5 years. Jackie is passionate about developing community partnerships with law enforcement, victim service providers, and the judicial system to create immediate response for victims and survivors of domestic violence, sexual assault, stalking, and gender discrimination. So Jackie, thank you so much for being here today.
Thank you, Emilie. Thank you for having me.
And I also have returning Rosa Abraham. Rosa uses she, her pronouns and is a bilingual crisis counselor and victim advocate at VSC while she pursues her PhD in forensic psychology. She is also a member of the Florida Crisis Response Team and other community task forces in Central Florida in an effort to advocate for individuals healing from trauma. So Rosa, thank you as well for being here today.
Always a pleasure.
You are on the podcast a lot, Rosa, and I really appreciate it. And I'm really, really excited to have you here as well, Jackie, because this is a really important topic that we're going to be delving into, and I'm excited to discuss this with both of you because today we'll be talking about burnout, signs that someone is experiencing burnout, and specifically how burnout can affect first responders and those that work with victims of trauma. So to start off, I think it would be beneficial to discuss some definitions. So could you both give a definition of burnout?
I think it's so important that we talk about burnout. We usually mention that term a lot. We use it a lot. And sometimes we don't even understand what does it mean and how much impacts our life, especially when we're in this field, what we call first responders, right? And one of the things that I was just talking, and I'm sorry, I know that you asked me the definition, but I need to share that it's been kind of eye-opening for me ever since the social distancing started, the whole measure that we have been taking in order to protect our community and protect each other when it comes to responding to the community's needs and everything that we're doing against the COVID and so many other issues. One thing that it was very eye-opening is the importance and how much we are in the front lines responding to those that are in need, right? That are dealing with some kind of crisis situation, how important it is that we are there, that we hear their story even before a lot of people, right? So that has an impact in all of us. Because we get to digest that story, we get to hear that, and sometimes we hear that story even before the survivor or the person itself have digested what have happened to them. So we leave that process, we leave that crisis with that individual. So when you do this job so much, and there's so many different elements that I know we're going to have time enough to talk about, we start getting exhausted, emotionally exhausted. This is a conversation that first responder have been having for a while already, because how do you deal with that exhaustion? How do you deal with that depersonalization that comes as an outcome of this situation? How do you feel accomplished? How do you feel like you're giving everything, but at the same time, you're taking care of yourself, right? So again, when we talk about a definition, it's important that we take in consideration so many different elements. What is our role in responding to the community needs? How much are we getting exhausted, emotionally exhausted in the process? But at the same time, we're dealing and we're struggling with our commitment, right? So again, how accomplished do we feel as professionals when it comes to going back home and saying, I did what I needed to do, and I feel satisfied because I was able to accomplish what I wanted to accomplish. So I think it's a combination of those elements. And I know Rosa, with her expertise in the field as well, she has seen this very closely. And again, as co-workers, as in the field and in the movement, we always get to share a little bit about that frustration.
Thank you so much for breaking that down. You brought up so many great points about like the identity of a caregiver and how that kind of relates to it. And I love that you began bringing out COVID and kind of this social distancing and how it's kind of amplified this. I really appreciate that. Rosa, did you have anything else you wanted to add about the definition of burnout?
So following the line of Jackie, we are first responders in the process of aiding survivors of crime, right? With that comes a long string of different factors that will eventually impact our well-being as professionals or caregivers, but also in the sense of our personal lives. So I think that while researching and refreshing my brain on the conceptual framework of what burnout stands for, is basically the balance between fighting symptoms of being somebody who's helpful, but then someone who is being impacted and manifesting these symptoms as frustration, sadness, hopelessness, maybe anxiety, stress, and different things that in a conglomerate doesn't fit specifically on one mental health diagnosis, but if we see is closely related to what we do as a career choice. So when I was doing my research, the term burnout was first introduced by Bradley in 1969 in the work with offenders. And it's interesting how this term came about in the psychology field, being with offenders. As we briefly know, offenders are often incarcerated and have a very complex psychological framework. And this psychiatrist first introduced the term based on his work with this population. Further down the road in 1974, excuse my pronunciation, but Freudenberger, I think is that what it is, explored how depression and frustration as symptoms were key factors in the process of burnout. And finally, in 1980, we had a theory proposed by Edelwick and Brodsky, which explained burnout in 4 developing phases. The first one, a lack of enthusiasm or the decrease of previous enthusiasm, a period of stagnation, followed by a stage of frustration, and then developing into apathy. And this is very important because when we go to the process of the final stage, which will be apathy, we're compromising our cognitive and emotional well-being. And in most instances, we can cause harm to ourselves, but also the people that we're trying to care for. So I think that as we saw in this brief timeline of the concept burnout, it started very simple, but with time, as many things in social science, had developed into a theory that could be more tangible into pursuing prevention.
Got it. I love that you brought up the different stages of it too. And later down the line, we're going to be talking about, obviously, we're going to delve into how we can process the burnout and then also prevent it. So I'd like to explore those stages again to see if we can maybe start seeing the signs and then maybe go the other way instead of get to that apathy that you were mentioning. But I wanted to also ask if we could also define the term vicarious trauma and how it can relate to burnout as a caregiver or someone who works with trauma survivors.
Yes, vicarious trauma, and then again, who hasn't been exposed to this, right? That's something that we deal with in a daily basis, and then the consequences, we're dealing with them, and we don't even understand what's going on, right? But it's an occupational challenge. We're being challenged in a daily basis, again, as first responder. And I continue highlighting this because one of the things that I have enjoyed the most since I moved to Florida, even though that I have already worked with that in Puerto Rico, is being able to work with the community partners, right? Everyone has a different role, but we're all part of the team, right? And everyone face the different challenges that comes with responding to crisis, responding and providing support to survivors. So there's different challenges, right? And one of the things that as first responders we challenge is the fact that we're continuously exposed to the trauma that others have lived. And then going back to what I was mentioning at the beginning, that experience, we live that with the survivors, with the victims, right? And that continuous exposure, that we're kind of relieving that process. And that's going to have some consequences in our mood. One of the interesting things about this, Emilie, is the fact that the trauma can be digested, or we can have different responses to it. It could be positive, it could be negative, but it can also be neutral. And that's going to have different outcomes depending on the way that we manage or we respond, or how much support we receive from the institutions that we work with, right? So the responses are going to be very individual, very unique. And then, of course, there's going to be other elements that are going to be present to kind of shape how bad or how good the impact of those traumatic experiences are going to be in our life. Because again, it's how much we are exposed, how much support do we receive in the process as first responder, and how much that kind of put in jeopardy our own stories, because we all have been traumatized one way or the other for any type of experiences in life. So all of those elements are present when we talk about vicarious trauma.
That makes a lot of sense. And I think, like with most things, it's a combination of a lot of different systems going on, a lot of different aspects. So I really appreciate you breaking that down. Rosa, was there anything you wanted to add about vicarious trauma as far as this conversation?
Not conceptually. Jackie really defined the essence of what it looks like. I just wanted to share some numbers to put a visual on how vicarious trauma can impact individuals in their role as a professional. So if we search, Dauphin in November 30, 2020, published a statistical data analysis on the most stressful jobs in the United States as analyzed through 2019. The highest one, represented by 72.58%, was enlisted military personnel, which are considered also first responders, followed by firefighters with a 72.38%, police officer with 51.94%, newspaper reporter 49.96%, And interestingly, it says corporate executive senior 48.97%, which that could be taken in different scenarios. I do see that throughout the brief research that I was compiling, supervisory personnel was also more exposed to burnout due to the conflicts and constant interactions between higher management and then the needs of the population that we're serving, obviously through the employees that they're overseeing. So it's interesting how nationally it's validated that 5 out of those 10 different professions that they have listed are first responders. And we're not even considering social workers, mental health professionals, medical professionals such as doctors, nurses, and other personnel. So I'm curious to see what the data is about to tell us in about a year or two about this pandemic, just because now burnout is making more sense. Yep. And I think that we have been exposed to it in academia as professionals with mental health, but now we're really seeing the impact as a pandemic.
One important thing that I want to bring with what Rosa is mentioning is, I don't want to say or believe that we were ignored, but with every problem or social circumstance, the nature of these other professionals and their role and how much they expose themselves in a daily basis, right? The fact that we work with survivors is a highly valid issue because we are exposed in so many different ways. The medical staff, it's exposed in so many other different ways. And I think circumstances like COVID, mass shootings, and so many others are kind of giving us a different perspective. And we're learning to see these professionals in a different way. I think we're getting into a point where we are starting to give them more value and see the importance that they have. One of the things that is important to mention when it comes to vicarious trauma is that maybe I have never been traumatized or traumatized in this way by the job that I do. However, I could be affected by one case tomorrow. So the impact of vicarious trauma can be negative, and it doesn't necessarily have to happen to everyone. In my case, I'm going to give you an example. I can hear the stories of victims, survivors of intimate partner, and I can deal with it. But when I work, that was my first experience as a social worker with children, that's the one thing I can't deal with. So it's important that as a professional, as a social worker myself, I understand and I know what can have a great impact in me, if that makes sense. So I can set boundaries. I'm going to give you one example. In my case, my first 6 years working as a social worker was with the deaf and hard of hearing community in a school for children. I think they were from 3 to 17, 18. So even though that it was a great experience, I realized that I was getting, my mood was changing. I was being traumatized by the experiences and maybe the situations of abuse and neglect that they were victims of. So I realized that for me, I can deal with the story of a survivor of intimate partner violence, but working with children, it becomes too much for me. I become very traumatized. I emotionally get affected by the situation. And I think it's kind of like the sense of not having the power to protect them that makes me feel that way. So at the end of the day, what I'm trying to say is that as a professional, I have to understand what are those areas that I am more, more responsible with the client, with the community, and with myself, and what are those areas or roles that I can have that I am better at it. So it's kind of knowing and setting boundaries. It's okay if I can deal or work with grief, right? It's okay if I know that for me, working in a hospice is not a good feel. So it's important that I know my limits. I know what are those areas that I could be more effective and more responsible with myself and with the clientele that I'm going to provide services to.
I think that's such a wonderful point to bring up, that it's also our personal background too, and knowing that about ourselves. And I think that actually leads me sort of to the next part of this conversation, which is, what are some of those signs that someone is experiencing burnout? And would either of you be open to sharing your experiences with burnout specifically? Because if we're seeing these signs of burnout, then perhaps we can know more of ourselves and set up those boundaries that you were talking about, Jackie. So with that, is anyone willing to talk a little bit about maybe their experience with those signs of burnout?
So I would like to speak about, how professionals who are working in the mental health field, but also those who are on call, we can significantly experience different impacts in areas of ourselves. And I like to call it the burnout triage. I don't know if it's real, but it's what I call it. And it's basically how it impacts our cognitive, psychological, and physiological well-being. So just to give you a visual, us as individuals on call, we are exposed to having optimum performance on our cognitive level, basically because as we are interacting with someone, we're being empathetic and we're offering them coping strategies and ways on how they can process their experience in a safer way than previous to them arriving to our services. So in that process, every time we are engaging with a survivor, we are consciously and unconsciously utilizing these three different areas of our well-being, right? So one of the signs that we can definitely identify when we're suffering from burnout, and I can speak by myself, is that I immediately notice a lack of concentration. I also experience difficulty with feeling calm. I may feel a little bit hyperactive or kind of like jumpy as of like, I want to get the solution so we can get through this and then I can get some rest, because our system is trying to regulate as well. So when we're dealing with another individual who is manifesting a crisis in front of us and we're having some type of symptom of burnout, our system doesn't necessarily going to receive that information as something to process. Rather, we're going to be reactive. And that's where the maybe physiological symptoms may take over, where we might feel a little bit restless or fatigue. Maybe our eyesight is tired. We're feeling pain in different parts of our body. Maybe we're having difficulty articulating the words that we want to say. We might be experiencing difficulty to remain awake. We might be having nightmares or episodes of restlessness, which may have us not being able to have a good sleeping habit. Or maybe our eating habits are being compromised due to our hours at work. So we need to be mindful about how these symptoms, as maybe one day I can lose a meal, but then if it's 7 days a week that I'm losing 1 or 2 meals, then we know that that's going to impact our physical regulation and definitely our energy. And psychologically, I think this one is kind of like the last one, because us humans have this awesome skill of being resilient. So I think that sometimes we think we can manage more. And because we may have some tools, we can keep adding things to our toolbox. But I think that the best indicator for us to understand that our psychological well-being is being compromised is when we're feeling the need to be isolated. So as a person who is highly extroverted, when I feel like I don't want to talk, I don't want to use my phone, I don't want to be out, I want to be rolled up like a burrito in my bed, that's kind of like my cue to understand that psychologically, I'm not processing the demands of maybe my career and then our personal lives. So I think that if we are aware of those different cognitive, psychological, and physiological indicators, we are in the route of prevention. I also wanted to talk about how safety planning could be a good tool in order to prevent fatigue in those three areas. I do know that our team in VSC, specifically the advocacy team, we had developed a safety plan where we talk to our team and we say those things that are indicators that we might need some extra support. So our superiors or peers are allowed to reach out and let us know, hey, I think you're not performing as usual. I think we should revisit your safety plan, and kind of have those second pair of eyes to give us support.
I love it, Rosa. I really appreciate you sharing your personal experience with burnout. I think even for those who might not work with survivors and victims of trauma, I think a lot of what you were saying is so relatable, especially right now. Jackie, did you have anything you wanted to add as far as your experience with burnout or some of the signs that someone might be experiencing burnout?
Yes, absolutely. One of the things that I have seen from not the individual perspective, like an individual, what I mean by that is when you provide direct services to those that have been victims of abuse and that are dealing with traumatic experience, sometimes you work in a different level of the system, right? Which is in the preventive area, working with the social policies and trying to develop programs, and the management area. Like when you work in that other level, you are in direct connection with community partners, with other agencies or centers, and you're trying to find other ways that we can all be in the same page and we can respond. And maybe victim survivors are taken in consideration when developing a program or an initiative in the county. When you're involved in that other level of the system, you can see those symptoms or effects of burnout too. And some of the things that I have seen very close and I have experienced myself, like you become you have a very low and very small patience to deal with that. You get frustrated very easily. You can sometimes be angry, right? Maybe you feel, and this is something that I have experienced myself, I feel like maybe it's going to be a waste of time, which is kind of the loss of hope that I think Rosa was mentioning, because you feel like it doesn't matter how much I explain this, maybe this other professional in this other setting is not going to understand or is not going to follow through. You become like, you start developing this sense that you can conquer the world. Like, it's up to me. I have to continue having this fight, this struggle, this challenge, and that comes from being passionate about this field. Like, I think everyone that is a first responder is in this field because they're passionate. They're passionate about what they do. They love their career, their profession, and they believe in this, right? And because of that passion, you don't have limits. Sometimes we give and give because we want to, because we want to help. This is not something that we do for the money. We do it and we practice this because we believe in it. And I believe at some point we have already had a conversation before today where we talk about how many of us are survivors ourselves, right? And because we have this commitment, we put ourselves out there and we do it without expecting anything in return. However, when you start having, and everyone can experience different symptoms or effects, right, of being a burnout. But I think it's important that we identify, how does it look like for me? And just like Rosa was mentioning, having a safety plan, having that connection with coworkers where you can openly talk about how you're feeling. because she mentioned isolating. And then you can have this other person, and that was me at some point, that I want to be there 24/7. Let me tell you, if the agency would have let me, I would have been 24/7 there. Because you start constructing and building these irrational beliefs that you're going to be able to conquer it all. When she mentioned the physical effects of, it's interesting. I have had even fevers. When I feel like physically exhausted, that's the word, exhausted, I start having chills, and then I'm going to have a fever. I lay down 15 minutes, and then everything's going to go away. Body ache, you name it. You go to sleep, and you sleep the entire night, but then you're having nightmares or you're having dreams, and it's not like you're actually shutting down. So again, you can see so many different effects of burnout, and everyone is going to experience it in so many different ways. Not being motivated for what they're doing, just avoiding specific clients or participants. So those kind of things, we can see them in the field. And then again, it's going to be very, very different depending on our role and how much we're exposed to those circumstances, on the management structure, how the agency puts their strategies to protect the staff. So we can see so many different ones, but having this conversation is so important, because again, just like abuse doesn't look the same in every victim survivor, right? The same thing happens with burnout.
I love everything that you brought up, especially this idea that because we're, people who work with trauma survivors have this passion, this identity of the caregiver, really, that kind of drives the need or the feeling as though you need to keep going, just keep going. But it's important to acknowledge that we're humans and we have needs, and we can't burden ourselves with everything. We can't shoulder everything. So I appreciate you bringing that up. I think that's such an important point as we continue on this conversation. And now that we've, defined what vicarious trauma is, I think it might be useful to use a specific event as an example of collective trauma and burnout. So that being said, could both of you speak a little bit to the Pulse shooting that happened in Orlando as a real life scenario to analyze?
Definitely. I think that when we speak burnout, there's definitely different scenarios and different levels of exposure. In this case, we want to talk about this real life situation just because everybody that thinks about a crisis or a collective shooting, immediately people think about Orlando and the Pulse shooting. First of all, it's a very sad event that unfortunately took the life of many people, and that also those that survived, including professionals who responded to the call, I think that they were impacted forever, right? When it's curious because when I first started in this role, Pulse had just happened. I wasn't in the role of a victim advocate, but I do know that the Victim Service Center had a team that responded to the crisis. And if we ask our supervisors and people who are still in the agency who were part of this community effort, they constantly go back to how difficult it was to manage seeing the emotional responses of survivors and family members and responders who have been working for extensive hours. Curious enough, many people who responded to this tragedy had left their careers because the emotional impact was so severe. So in this situation, I kind of wanted to go back to how these stages may relate, right? On how the enthusiasm may be impacted because maybe we're in that existential crisis and searching after responding to this kind of event. how am I going to keep energized doing this role? Am I going to be safe? Is there anything that will be considered rewarding after being a survivor of such incidents and things of that nature, right? There could be the stagnation of maybe the performance is lacking or the person is avoiding to be exposed to specific tasks of their role just because they don't want to go through a similar experience. Maybe the frustration because they feel like, you have a purpose and maybe my career to me is significant to my identity. And now because of this experience, I can't do it anymore. And then we have the apathy, where slowly but surely you may be encountering instances in your service delivery where maybe you were known for being empathetic and now you're just trying to get the job done. So I think that as a secondary survivor, a lot of people remember how this shooting impacted everyone because they were able to see the emotional thread that many communities were impacted by. I know that now there's a lot of different trainings targeting this kind of response, aiming for the prevention of those who are caregivers and those who are responding to this kind of situation to not be impacted to the way that our responders were through the pulse shooting.
I love that you brought up the stages again and kind of the different signs as well. And for also explaining the shooting itself. I also wanted to bring up, Jackie, you were bringing it up too about COVID. And I can't help but think of that, honestly, as we go through this conversation. So could you speak to how it may have affected trauma survivors and those that work with them? And specifically, if we could dive into this term called Zoom burnout, as well as the constant transformation everyone is collectively adjusting to. And those possible effects, that would be great too.
Yeah, absolutely. I think everyone, regardless of their role in society, their profession, and how much or how less have been being exposed to the COVID, everyone have had to deal with a very different way of doing things, right? I think we're all, as a society, humanity itself is trying to maneuver this whole situation and mostly trying to find the best way to reinvent ourselves. So from a personal perspective, I think at this point almost everyone knows someone that have had COVID, right? Sadly, a lot of us have also lost loved ones due to COVID. When it comes to the community and our relations with others, that's something that have been impacted as well. We cannot relate to others in the same way. A day like today, we're here and we're doing this amazing podcast through this setting. But we know that maybe if it was last year, we would have met and we would have been there with one another. I think we have also evolved into this culture where we see each other and we are happy and we just want to hug ourselves and be grateful that we're seeing each other, but we cannot do that anymore. So we're trying to adjust to so many different ways of expressing our happiness of seeing each other, of sharing settings and forums like this, but it's not the same. We're here already in this season of the year where we're supposed and we all have been used to getting with each other and just spending Christmas together and just just going through this what we consider to be normal, being around one another. And now we have to reinvent that process. Then when we look into how much we are supporting survivors, participants, clients into having access to different programs of services, we are also seeing something different. A lot of different settings have been affected by not having that many funds as they used to, maybe having or being short of staff, or having to work in a very different type of circumstances to protect their staff. So we're seeing that impact in so many different ways. So yes, everyone is going to get affected one way or the other. I think if we look at it from a perspective of the profession and how much it has affected every discipline, I think it's going to be very unique to each one of them. A lot of relatives have received the COVID from a first responder that is a member of the family. So there's so many different ways, and with this COVID, one of the things that you have to do in order to protect your loved ones and even protect yourself is isolate. So isolation, even though that might be a coping mechanism to deal with some other issues, at the end of the day, when you're feeling sick and you have to isolate from others, it brings with it like a very heavy um, pack of emotions and thoughts, and it's not just that you're going to isolate maybe 1 day, 2 days. No, we're talking about weeks. And of course, we know that it's going to be very different from patient to patient, but we were not ready for something like this. We're still trying to understand. We're still trying to come up with the best strategies. We're still seeking and looking for information so we can make better decisions in our work settings at home. So I think it's a process of reinventing ourselves. It's a process of trying to find a balance between what I'm supposed to be doing and the way that I used to. And it's a challenge. It's a challenge for us. It has some different outcomes, and the way we deal with those outcomes, with that adversity, it's going to be part of the socialization process for our children as well, because maybe we're not in the same mood. So again, it's impacting us in so many different ways. It's impacting not even a medical appointment. I just had an appointment with my doctor last week through the cam, and it's sad because again, you want to get yourself checked up for allergies or something, but there's some measures that we have to take, and then you question yourself, but am I not supposed to go to the doctor to check myself? So those things are so different, and it brings a lot of different concerns and anxieties and fears and stress, and how to deal with it and how to adjust. So adjustment is a hard process for everyone. So yes, it's going to bring a lot of different challenges, and I think we're going through them. As Rosa was mentioning, at some point, it's going to be a matter of time to see what's the impact that this is going to leave behind, right? In our way of living with one another, in the way that we're doing our job. So yeah, and see the transformation that our society is gonna have.
Those are such great points, Jackie, especially that idea that, I often forget that we're getting new information all the time from the CDC, and, recently they changed the quarantine time from 14 days to 7 days. And I think that, yes, we're readjusting constantly, like, how do we get our groceries? What is the safe way to, do our doctor's appointments and all those things. And I think that's so important to bring up, that we are constantly readjusting. Absolutely. Rosa, is there anything you wanted to, piggyback off of that?
Sure, and I'm just going to be brief on it. Sometimes I like to think that we work kind of like in the shadows when we talk about trauma and victims and people who work in this field. while people were trying to adapt to their normal routine, we were trying to adapt on how to keep serving these individuals, how to keep responding, how to be safe, how to be healthy through this pandemic. And what I did notice is that the helpline calls increased for a period of time where we actually had people calling with dual victimizations, including domestic violence and sexual violence, human trafficking, and other more complex situations, just because the pandemic added an extra layer of stressors. And this is not even counting those financial challenges or maybe other things that we are commonly exposed to. But we also saw that we still were responding to cases even though people were supposed to be isolated. So it's kind of interesting how, for depending who you're going to ask, the experience is going to be completely different. And then also how our research professionals are so proactive that I actually found an article by Dr. Jenna Lee called Neuropsychological Exploration of Zoom Fatigue. And let's just keep in mind, this has been less than a year. And this doctor was able to kind of identify the rhythm of how Zoom has impacted our life. And in the other side of the spectrum, could be considered a positive tool. Why a positive tool? Because for us, it added an extra layer of accessibility for individuals who maybe weren't able to go in person for therapy or were experiencing some other delays in their healing process because just the timing wasn't right. So being able to go into the home of people has been a little bit beneficial for some, yet I have the impact on the negative side of the spectrum. So one of the things that Dr. Lee pointed out was that with time, individuals had identified a lack of motivation, a decrease in performance and the rhythm of their work, identified environment limitations, which could be, dividing that role from, I just finished 8 hours of working, now I'm just staying at home and chilling. It's kind of like psychologically difficult to distance ourselves from those two roles. The social awkwardness. And I think we can all speak about this on the responses that we have while on camera, or the technical glitches, or the difficulty of overlapping while somebody else is speaking because maybe their signal is better than mine, and those kind of fun things that we've been experiencing. On a little bit more serious notes, the memory was compromised according to the data analysis. The physical discomfort increased. That could include eyesight, body aches, and other discomforts because you're basically bounded to a computer. The mental fatigue, the lack of perceived reward, the lack of social engagement, and most importantly, since we're talking about neurological functioning, the lower brain activation that the Zoom engagement actually initiates, which compromises the attention, the retention skills, the minimization of responses, and our emotional regulation. So I think that we should start exploring how we can balance these new adaptive behavioral patterns. And I'm sure we're going to be able to tap into those strategies on how we can cope and then also prevent or minimize the exposure to burnout through Zoom or through our daily routines.
That is such an amazing article that you shared, Rosa. I think that kind of highlights the complicatedness of what we're going through right now, and how it relates to burnout. And I think we can all agree that things like burnout are not talked about enough. Do you think that the culture that we live in encourages us to ignore burnout? For example, men in law enforcement are taught to carry on or man up. And Jackie, you were talking about how, based on like caregiver identity, I think we have this push of, well, if you're passionate enough, you'll just keep going, or maybe we live in a society that overworks us in general. So I wonder is our culture making it so that it encourages us to ignore burnout in general?
I think we are one way or the other. And it depends again in the field. From a law enforcement perspective and working with them and also facilitating discussions about abusing later life and so many other topics like intimate partner violence, there's a lot of expectations of the role. There's a lot of expectation in our role as social workers, as mental health, and sometimes that expectation it's around your commitment, your sense of commitment with what you're doing. And of course, we start building this belief that starts affecting. But one of the things that I think it's important that is happening nowadays is we're having more conversations about these topics. We're talking about burnout. We're talking about being trauma informed. We're talking about and the importance of taking care of those that are taking care of others, right? Just like you mentioned, being a caregiver. But then there's so many different, as I mentioned, expectations. And one of the things that sometimes law enforcement tells you, I cannot complain about this because if I complain, I might be taking away from what I do, right? I might be seen like I'm weak and I don't have the tools to do my job. So the same thing happens in my type of setting. Sometimes having conversations about vicarious trauma with my coworkers, sometimes they say, you know what, I don't want to say no when somebody asks me for a favor, like in the work setting, right? Because I don't want to feel like I'm not helping, I'm not being part of what we do in a daily basis. And then how does, from the administrative perspective, management perspective, we're starting to develop this language of no, it's okay, that we have to set boundaries. We have to start talking about the importance of having my time, me time. And sometimes even encouraging for staff to take a day off so they can, disconnect from what we do in a daily basis, right? So again, there's so many expectations of commitment, of being there for those that we provide services for. But I want to say that at the same time, we're starting to break those down and started to talk a little bit about what's the impact of burnout, what's the impact of these issues, not only to ourselves, but the survivors and the community that we serve. Because if we don't care and we don't take care of ourselves, we're going to end up going in a different direction of what we hope for, right? Which is serve, which is to be there, which is to reduce the possibilities or chances of them to be re-victimized or put in jeopardy their safety. So I think the conversation started. I think we're starting to make some changes, and I'm hoping that when we talk about this topic again, maybe in 1 year, 2 year, 3 year, I don't know, we're gonna be talking about the impact that all of these conversations have had. I always say and mention to my coworkers, I know this is an expired conversation. We should have done this like so many years ago, but we're here. And because we're here and we have had those different challenges, now we can give a turn to all of this and move into a different directions for those other generations that are going to be doing what we're doing now. Because at the end of the day, and going back to the COVID topic, COVID and so many other issues, mass shootings and all of those different issues that we're seeing now that maybe we didn't saw in society happening like years ago, they're going to have an effect on humanity, and we're going to be facing other issues that we haven't even heard of, right? Nowadays we talk about intimate partners, we talk about human trafficking, and sometimes it's hard to describe what does a human trafficking situation looks like, right? And this is now, we're getting to know these social issues, but we don't know yet other social issues that are going to come out. So we have to be ready for those. We have to be open and hear people, their concerns, because they're the ones that know what's happening out there. There's the one that knows what's happening in the field, and we're just tools, and we have to be ready, but we also have to be flexible and open to look for strategies to better respond to those.
I actually just wanted to briefly say that aside of the clinician expertise that we may have, I actually want to extend gratitude to educators such as yourself, Emilie, and individuals who take the time to research information to give us the tools that we use to practice every day. And what I would actually love to see is more designated programs specified to helping our first responders being in the equal balance of not feeling like their gender roles or other types of their identity may interfere with the performance that they have, exposing them as a risk factor to burnout. So I will hope to see in the following years how our community agencies, such as law enforcement, are more engaged in trauma-informed training for themselves and for victims, but ultimately to keep ourselves healthy and not be in a position where then we're having to step out from our career and then spend a lifetime healing from the wounds of our performance.
I really appreciate that, Rosa, and I think you're absolutely right. That would be a wonderful training to have for our first responders and for those who work with survivors of trauma. I think that would be such a powerful tool, and I definitely have to look into that now. That's amazing. I love that idea. Going kind of off of what you both were saying, where it's very possible people listening might be noticing signs of burnout within themselves as we talk about this. So that being said, what are some ways we can recenter ourselves and recharge?
I think that one of the first things that we need to be in tune is with self-awareness. It may be kind of easy to articulate, yet it's very difficult to practice. I find that, like Jackie was saying, sometimes in our field it's so difficult to say no or to acknowledge that we're suffering some symptoms of what we're also assessing when we're working with survivors of trauma. So it's kind of like a parallel challenge, if we may call it something. But some of the things that I like to educate my survivors on, but also I have been incorporating it into my self-care routine, includes setting clear boundaries. And this could be for personal purposes, interpersonal relationships, or in our professional role. We need to understand that we're not going to save the world, that yes, we're active agents of social change, yet we need those spaces in order to keep a balance between the situation that we're exposed to and then the tools that we can provide. One additional one will be delegating. Sometimes we find ourselves that because we're good at something that we want to make sure that everything gets done our way, but it's not necessarily true. So delegating will be a good way to not feel overstressed or overwhelmed where you're trying to be part of a team approach. Practicing self-compassion. I think that one kind of like goes in secondary priority when we talk about first responders, because we're so in tune with providing the best empathy tools that we can, that we forget about ourselves. Developing a safety plan, and not also developing, but practicing it. It's not to have it in a binder or in a wall. I will actually encourage you to have it somewhere visible, or maybe have a reminder in your office, in your room, somewhere where you can say, okay, it's time to, revisit my safety plan. Practice assertive communication. Assertive communication, I think that we kind of think we are assertive in most scenarios, when in reality, we're not. Being able to say no is part of being assertive and also mindful about our emotions and also the ones that we're trying to communicate with. So getting acquainted with what will be those skills that make me um, a eloquent, assertive communicator will be a good assignment for you all. And then engage in therapy. Let's break the pattern. Let's break the stigma. We offer the service, but we're human beings as well. And therapy is creating our safe space. So why don't we create our own world, expose our vulnerabilities, and try to get more stronger? Not by feeling undestructible, but by feeling that you also know when to step down because of you and because you want to keep in a field that needs you, but also understanding that exposing yourself to the outcomes of burnout is not a healthy way of being a caregiver.
I love that. I love everything that you're saying. And I love that you brought up the, let's break down the stigma of reaching out to therapy and absolutely. Jackie, was there anything you wanted to give as far as advice or things that we can do to help recharge after burnout if we're experiencing it?
Yeah, absolutely. And Rosa just mentioned having your own therapist. I think it's so important that we have that person that we can talk to. But we're actually assuming the role of the individual that is receiving services, that is being taken care of, instead of going to a session and put our knowledge in that session, if that makes sense. Because that's something that you hear a lot, right? As social workers, mental health, or clinicians, law enforcement, whatever our role is, when we receive therapy, we deserve to be taken care of. We deserve to be the main, to receive that main attention. And I think that's our time. And I say that because I have had, when I was in the clinical field, I receive a lot of cases by professionals that were actually seeking services, but then they get into that mode because we are programmed in thinking from an intellectual perspective. But that's the moment where we get to be the human being, where we, just like Rosa was mentioning, be vulnerable. Having a healthy eating habits is a very important one. Also, practicing exercise, whatever it is that works for you, it's important to put it in practice. Sometimes people prefer to go for a walk, others prefer to go to the gym, yoga, you name it. Whatever it is that works for you, at least put it into practice and kind of set a routine so your mind and body gets used to that. Another important thing is education. And just like Rosa was mentioning at some point, being aware of this issue, and not only being aware of it, but also taking the time to be mindful and see how this looks like in my life. Again, Rosa was describing the way she can identify that she's burnout. Her symptoms or effects are very different from mine. And we can have some others that are common, but everyone has a different outcome, a different effect. Another important thing to mention is building that partnership. And I always end up talking about this because when, as a social worker, advocate, whatever your role is, you have a situation and you're providing services, there's no better feeling than reaching out and receiving support from another agency. And that's something that I'm not saying it because Rosa is here, but we have worked together, and it gives you so much hope that know that there's other people that care, that there are other people and professionals out there doing their part and contributing in so many different ways. And this is something that everyone can contribute. The different organizations out there, church, you name it, everyone have a role in this process. So that's another important thing. Taking time to self-care. And we were just talking about this in the office, and there was this very interesting picture I saw of this lady taking a bath, and there were I think like there was candles, everything that they recommend to do self-care, it was in that picture. And just by looking at that picture, you will get the message. It was overwhelming, because then again we have the pressure. Am I taking a bath up? Am I listening to the music? Am I painting? Maybe painting doesn't work for me, and that's okay. Maybe putting a candle doesn't work for me, and that's fine. Everyone has a different way of disconnecting and just getting into that relaxed mode. Rosa, for example, I know she's a great artist and she paints a lot. I do paint on my spare time too, and it works for me. But maybe for somebody else, it will be stressful. For me, Netflix is amazing. I just disconnect and just watch movies, and that's something that works for me. Cooking is something else that I enjoy. So everyone is important, that everyone takes the time to discover and to do a list. And it's not that we're going to engage in this type of activities when we're feeling burnout. I think what's important, and it's part of having a safety plan, just like Rosa was mentioning, we have to set our own calendar and schedule these activities so we practice them in a regular basis, and we prevent the outcome of what vicarious trauma is and burnout. The other important thing is, as organizations, at agency, we have to start moving into a different direction. And with that being said, we need agencies to be very proactive in addressing the impact of vicarious trauma, the impact of burnout. And the outcome of that is going to be that we're going to have policies that are going to be trauma informed. We're going to be and have procedures that are more opening, that are more welcoming. We're going to have practices that are going to support the staff and are going to provide them with the resources so they can have and take more care of themselves. And of course, we're going to have programs put in place, not only for those that receive services from our agencies, but for staff. And what we want with all of those things is actually mitigate the risk of having this negative consequence or impact, because at the end of the day, it's a reality. It's going to happen. One important thing that I wanted to mention when it comes to education, part of the deliverable and something that we're going to be working this next year and 2021-2022 is actually developing a curriculum that we're going to facilitate for other community programs, including law enforcement, where it's going to be around trauma and vicarious trauma. So we're actually working on that. We're actually working in on the curriculum for our staff, and then afterwards we're going to start working for the community partners. And what we're hoping is that we're going to be able to facilitate that discussion, to build a foundation so we can have a community that is trauma informed and that is going to respond in a different way, because they're going to recognize that anyone can have a traumatic experience, and what are those approaches that we should have, but also to build skills and knowledge in how to take care of ourselves. So then again, we can prevent and we can put in place the different strategies to, again, build in compassion, satisfaction, build in vicarious transformation, build in resilience, and again, accomplish what we came to this field for, to be inspired, to be looking into the transformation and not the needs of those that we serve, right? To look in how we all overcome the circumstances that we're dealing with, and to be part of and have that connection with others in this journey, where we're actually feeling like we're part of that change and we're making that a reality. So that's what we're hoping for, and I know this podcast is going to be one step in accomplishing that, and in our future conversation about this amazing initiative.
I love that. I love that initiative that you started with your community partners. That's wonderful. Going off of that, what are some other resources that people can reach out to if they want to learn more about, burnout or this topic in general, or if they're experiencing a lot of what we talked about today? I know we mentioned, reaching out to a therapist, but I wanted to see if there were any other resources that you all wanted to kind of highlight and lift up here.
There's multiple publications. I actually was referring to a book of burnout. So I would encourage individuals who are interested in the topic to go to a local library or search our dear friend Google on different publications about the topic. While doing so, I found strategies, I found indicators, and even templates for safety planning. I will also research on statistical data and national data analysis portals who can offer a scope of what burnout looks like or how those risk factors associated to the prevention of burnout are being currently studied. I will also encourage to reach out to helplines if you have any questions or professionals in your community to engage in conversation and see what other resources could be available for your curious mind and definitely your effort to not indulge into burnout.
Yeah, I would also like to add, in regards of our journey working in this area, the National Center on Domestic Violence, Trauma, and Mental Health, they have amazing resources, and they're available online, where you can actually download them and benefit, because it's so rich in information. And even when the center talks about domestic violence, it really works with any type of violence and for first responders. SAMHSA, Substance Abuse and Mental Health Service Administration, also have very good resources. And again, just like Rosa was mentioning, I think it's depending on what is it that you want to look for. But doing the exercise of reaching out, of start looking for that information, you're going to find so many different centers and agencies working with this, because they recognize the impact. So again, when it comes to our county, we're kind of working with this, so you can definitely reach out to us, and I will be more than happy to share any of the resources that we have identified so far and that we're using as a reference to develop our initiatives. So you can reach out to Help Now of Osceola, the Outreach Center. You can contact us at 407-847-3286. I have gathered and started accumulated a lot of different resources. And again, as I was mentioning, I will be more than happy to share those with you. And then hopefully by next year or the 2022, we're hopefully going to be having a little task force where we sit down and try to find ways that we can better respond to survivors or the circumstances that our community are dealing with from a trauma perspective. And then, of course, why not? And most important, how to respond and support our loved ones, our first responders in the community.
Absolutely. Thank you so much for sharing all of that really important information for everyone out there. And I think that that's a wonderful place to sign off, unless there's anything you, Rosa, or you, Jackie, would like to bring up in regards to this topic that we may not have discussed.
I believe one of the things that I had here, and maybe it's not the part that it should be included, but there's higher risk to being affected by vicarious trauma. I don't know if you want me to mention them.
Sure.
Okay. So there's a risk for to be affected by vicarious trauma, and one of the risk factors, which it was very interesting for me, is having prior traumatic experiences. And then again, at the beginning of the podcast, we were mentioning that sometimes a lot of the providers of services for victim survivors are survivors themselves. So that includes having a prior traumatic experience. Social isolation is another one, and both in a personal level and in the work area. So not being around other people, not being around and being able and open to communicate how you're feeling and stuff like that, it's another risk factor. A tendency of avoiding feeling or communicating or expressing their emotions, just like I mentioned, maybe blaming others for how they're feeling and kind of redirecting those mood. Lack of orientation, and this is very important because those that are starting in this field, because of the lack of experience, they're more exposed in not being able to identify what's really happening and why is it that they're feeling the way that they're feeling, and maybe feeling that if they say something, maybe they are not fit to work in this field. So that's another risk factor. And then, of course, being exposed to constant traumatic experiences or incidents or survivors or clientele that they're dealing with. And then, of course, just like we mentioned before, not having that support from the center, supervisors, or the community itself, which of course is going to open the door to be traumatized or experiencing that burnout that we've been talking about.
Absolutely. Those are all fantastic points. And again, I think that that's a wonderful place to sign off here. And I just want to thank you both. And I also want to thank the listeners for listening to the Victim Service Center podcast. The VSC is a nonprofit organization that provides free confidential counseling services for victims of any kind of trauma in Central Florida. To learn more about our services, please visit victimservicecenter.org. And to everyone listening, healing is not linear and you are not alone. And thank you so much, Rosa and Jackie, for joining me today.
Thank you so much for inviting me. And as always, you have a partner here.
Thank you so much, Jackie, for being part of this initiative. And I will see you in the field.
Absolutely.